Hello, welcome. I'm Michelle Simino. I'm an internist and a current board member for the Southern Pain Society. We at SPS are getting really excited as our next virtual conference is coming up soon on March 12th and 13th. We're really honored today to have one of our presenters with us. That is Dr. Todd Sitzman. Dr. Sitzman is Medical Director of Advanced Pain Therapy. It's a comprehensive pain clinic located in Hattiesburg, Mississippi. He's board certified in anesthesiology and pain medicine. He's authored more than 80 scientific publications and serves on the editorial board of the Journals of Pain Medicine and Pain Practice. Welcome, Dr. Sitzman. Thanks for being with us.
Thank you, Michelle.
So, excellent, great, thanks. We're glad to have you. And we're excited about your upcoming talk on osteoarthritis of the knee. Can you tell us a little bit about your experience with knee osteoarthritis?
Well, I don't think there's any pain specialist that, at least practicing general pains, that doesn't see osteoarthritis on a daily basis. It may not be the primary presenting symptom, but it's certainly one of the comorbidities. I don't think, when you just look at the epidemiology of osteoarthritis, that and specifically the knee itself, it's one of the most common forms of osteoarthritis. The lifetime risk of developing osteoarthritis of the knee is nearly 50%. And it's greater, it increases as we age. It's debilitating, it has significant impact on quality of life. And there are, quite often a patient says, well, I've done everything I can do for this and I still have pain. Well, hopefully some of the attendees of this meeting will learn that there are many things out there, that there are many things that work, there are many things that don't work, and we're going to review that in my session.
Excellent, and I can certainly attest to the fact that knee osteoarthritis is certainly something that's ubiquitous in a lot of practices, internal medicine, family medicine, ortho. I mean, this topic really touches a lot of us.
Yes.
What makes this such a timely topic in this current environment of pain management?
I think too often as a pain specialist, we look at someone with a chronic osteoarthritic condition and say, okay, they've tried these medications and they're not working, or they're limited in their effectiveness. We've done physical therapy, we've done bracing. The surgeon has said, he has offered surgery and knee arthroplasty, but yet either the patient hasn't had it, doesn't want it, or has had it and still has chronic pain. These are all major issues that we face at least daily in my practice, weekly in other individuals' practices. What we lose sight is that pain from osteoarthritis is not just the pain at the joint level. Certainly there's sensitization at those peripheral nociceptors within the joint space. So certainly there is joint pain, but day after day, year after year, decade after decade of a chronic pain condition leads to central sensitization, that even when you correct the underlying source of that pain, the pain persists. And as a pain specialist, we lose sight of that quite often. And there are many modalities out there that can help with that. And in my talk, I'm going to speak about some targeted therapies for pain pathways, for peripheral nervous system, central nervous system pathways, and means of effectively treating those.
Excellent. And I love that you mentioned central sensitization, because many of us don't often think about that in the same realm as osteoarthritis of the knee. What message will you have for those in attendance for your talk at Southern Pain's virtual conference in March?
My main message is these are the therapies that are available. Avail yourselves to these therapies. Assist your patients in finding the right therapy. What troubles me most is when a patient says, well, I've had a knee arthroplasty. My knee's been replaced and it's still killing me. And the orthopedic surgeon said, look, my knee replacement is perfect. Look at these x-rays. There's nothing wrong with your knee. and yet their pain still is still present. Those individuals who see that with their patients, those physicians, clinicians, come to the lecture. We're going to talk about that.
Well, Dr. Sitzman, that sounds great. I can't wait to hear more about it. Thank you so much for joining us today. And I look forward to hearing your whole talk on March 12th and 13th.
Thank you.
Welcome. Thank you so much.